back from the break. I'm your host, Sarah Danuteshna, and we're now counting down to the last 30 minutes of the show. Today is Wellness Wednesday, and as we stated earlier, that our main focus of the day is going to be on fibroids. Joining me in this conversation is Cecilia Karanja from Fertility-Kenya. Karibu sana to K24 Alpha Jury. And then we have Dr. Oindi Felix, who is a gynecologist from Aga Khan University. Very nice to have you. Karibuni sana to K24 Alpha Jury. Maybe you can just tell us more about yourself before we start the conversation. Let me start with the lady, Cecilia.
Okay, my name is Cecilia Karanja, founder of Fertility-Kenya. Fertility-Kenya deals with persons affected with infertility. Yes. Okay, my name is Dr. Felix Oindi. I'm an obstetrician stroke gynecologist at the Aga Khan University Hospital. And part of my day-to-day work is to attend to patients who have various problems, including uterine fibroids.
Okay. Karibuni sana. We are so happy to have you this Wednesday morning. And as I stated earlier, that we are going to be focusing on fibroids. And before we actually delve deeper into this conversation, maybe we should understand, for those people who are watching the show and they still don't understand what fibroids are, let's start by defining it. Let me start with you, Dr. Oindi.
Okay, so uterine fibroids are non-cancerous growths of the uterus. They usually it's the commonest growth actually found in the reproductive system of women, and affects women of mainly the reproductive age, which means the ages of about 15 to 49, though they can be found after that, and they present with various symptoms. Most of the time when you have them, you don't know you have them. Actually, majority of women are walking outside here and they don't know they have them.
Yes.
The few who get to know they have them, mainly it can be because they came to hospital for another reason. And those who come for the reasons mainly will come with things like bleeding. Usually your periods become heavier than usual. Your periods will become more painful at times. And occasionally when they are very big, they can exert pressure on the surrounding structures. So surrounding structures in this case is the urinary bladder, which is in the front. So patient will report that they usually need to go to the loo many times a day. When they are at the back side, you'll present with constipation. Of course, occasionally when they are very big, you can also find somebody looking like they're carrying a mass. You could think they're pregnant, just because the uterus has enlarged so much, and they could look like they're carrying a baby inside.
Yeah, so the tumors grow with time.
Yes, so the longer you stay with it, the longer it grows, till you reach the age of menopause, where we expect naturally, as your hormones start declining, the fibroids also start shrinking in size.
Okay. And Cecilia, this is such a big problem, especially, you know, with girls and women, because 20 to 50% of the women who are in the reproductive age are actually suffering from fibroids, right? That's a very high number.
True.
Yeah. And so why do you think that most of the time it is impossible actually for us even to go get checked for this, to go for regular checkups? Yes.
I think why we don't go for checkup is because we think we are very normal, unless we get to a point where doctor is saying you have maybe heavy flows, or maybe you're looking for a baby and you're not getting. So that is why you realize maybe you have a problem. And by the time when you go to the doctor, when they check, they see that you have the fibroids. But I think it's a high time that every woman should be checked for fibroids. And I always say should be checked also for fertility, because you could be fertile today, tomorrow you don't know about it. So it's very important to occasionally go for checkups, for fertility checkups. And among the fertility checkups is the ultrasound, where you're checked whether you have the fibroids or not.
Okay. Yeah. So what exactly causes the fibroids tumors, if I may ask, Dr. Oindi?
Okay, so the actual cause of fibroids is actually not known. It's we call it a disease of theories. When we say theories, it means people have come up with various explanations to try and answer the question of why does somebody have fibroids. You'll get two people with all characteristics that are the same, but one has fibroids, one doesn't have. So the commonest cause of fibroids, or the commonest risk factor for fibroids, is actually being black. When you are a black race...
Which is strange.
Yes, it's somehow strange.
Yes.
But it's actually a disease that is not very common in the Caucasians,
Caucasian, yes.
or non-black. And black doesn't necessarily mean black skin color, just mean the black race. So whether you are black but very light, you still have the black race. So it's a disease which is very common in the blacks, and it's estimated that by the age of 50, 7 to 8 out of 10 women actually have fibroids. So mainly it's the being black. Now the other things which have been shown to be attributed now include if you have a family history, your sister, your mother, your aunties have had fibroids, then you are at increased risk of having fibroids. Those people who prolong the childbearing, at least you find you're having your first child maybe by the age of 35,
30s, yes.
40. Also, you find you've given the uterus enough time to grow those things. But there's still people you'll get who are in their 30s and 40s and have not had children and they don't have
And
it.
they're okay.
Yeah, so those others are mainly associated factors, but not really answering the question of why did this person have fibroids and not the other one.
And I was actually just reading somewhere yesterday, and they were saying that obesity can actually contribute. It's a contributing factor. Is that true?
Yes, very true. So the problem with excess fat in the body is that it gets converted to a hormone called estrogen. This hormone called estrogen is actually the one that drives the growth of the fibroids. And that's why when a lady usually gets to menopause, the fibroids start shrinking in size. So when you are obese, the excess fat gets converted to estrogen, which then stimulates the growth of the fibroids. And even those women who've hit menopause and they're obese, some of them, we find their fibroids will not shrink as fast as those who are normal body size.
Okay. And now, since Cecilia, we don't know the causes, can we identify like some of the outstanding symptoms that you can actually look out for, just to know that, okay, fine, if you have this, then there's a possibility of you having fibroids?
Okay. I think there are those things that you can really outline, because I also had fibroids, and I was done laparoscopy to remove the fibroids, and unfortunately, I think after my third born, I was telling Dr. I was told that I still have some. They have regrown back. So I think the main how you can detect that you have fibroids is heavy flow. Yeah, like for me, I really have very heavy flow.
And by heavy, what do you mean?
Your periods are very heavy.
That's from the first day?
From the first day to the last day. Maybe the first, second, and the third day are very heavy. And like the other people, you find the first day is not is not heavy. The second day is a bit heavy. Then you will find that like it would even extend to even 5 to 6, 7 days. Yeah, and then the other thing is pain when you're having your periods. Like I do experience the pain when I'm having my periods. So basically, those are the earliest symptoms. Yeah. Yes, and those are the things that I've realized.
Yeah, and when you talk about pain during your menstrual cycle, a lot of people think it's normal. Like it's normal for you to feel the pain. Do we have anything like normal period pains?
I think for me, it's when you have fibroids, it's to the extreme. Even if you take painkillers, like
they don't seem to work.
They don't seem to work, but it depreciates, but it's still there. And like when you have normal periods and you take painkiller, it will just disappear. But I don't know, maybe Dr. could explain to us, like if that is what happens. But for me, that is what I've experienced.
Okay.
Yes.
Okay.
Yes, so that's very true. Actually, the three main symptoms of fibroids, as she has said, is the pain, and the pain is usually during periods, bleeding, and most of the time you find it's a change of your bleeding pattern. So I can't really say because you use, say, during your heaviest day, 5 pads a day, and that's how you've been using them all along since you started having menses. That's because of fibroids. There are other causes of heavy bleeding, which is the reason why we encourage those who have such symptoms to come for checkup. So if you, before your period, so in a particular pattern, you bleed for 3-4 days, on your heaviest day you're using 2-3 pads or 4, then now you start having, you're using 5-6 pads. At times you have to use the heavy-duty pads. At times you have to use double pads or use a tampon and a pad. So it basically means your bleeding has got heavier. The additional one, she said, is a mass symptom, the one you feel that there is a mass on the body, and at times you can see the tummy looking big. And a few patients actually will present with symptoms of having been trying to conceive, and they're not getting pregnant. So actually, inability to conceive is one of the symptoms also. So that when we start doing the workups, we find actually you had fibroids, which were preventing anything from growing. But I'll still emphasize that majority of patients don't have any symptoms. Actually,
whatsoever.
No symptom at all.
Yes, because I was actually just looking at some of the symptoms, and they said frequent urination. So how do you differentiate that with the UTI? Because it's the same thing.
Yes.
Yeah.
Yes. When the fibroids are very big and they are on the front side, they will put pressure on the urinary bladder, which is the urine bag, really. And when they're putting pressure on the urinary bladder, the bladder will not expand to its full capacity. So you find it can only hold small volumes of urine. So you find whatever comes in needs to come out. With a UTI, you'll still have those symptoms, but actually your urine, you'll have a burning sensation when you're passing urine. So you have the key symptom is this other one has no pain, this one has pain. But in terms of urinating more frequently than normal, both symptoms are the same.
They're the same.
The other key thing about a UTI is at times when you go to empty the bladder, you feel like there's some remaining, so you want to go back soon after. With fibroids, that is not the case.
Yes.
Most of the time, you just pass and you are okay.
Okay. And then we have painful intercourse. Can you explain to us how that happened?
Yeah, so another common symptom is that painful intercourse. And most of the time it's because the structures that hold the uterus in place get overstretched by the fibroids as they grow. So any other additional pressure from outside is going to stretch them more. And that can cause painful intercourse. But also there are other conditions which could be coexistent. So you see, fibroids most of the time don't stand on their own.
Yeah.
So you could have fibroids and you find you have another condition causing painful intercourse. So painful intercourse per se is not a common symptom of fibroids, though it can occur. There are conditions like one called endometriosis, which is a more common cause of painful intercourse, which also causes actually painful bleeding as well.
Absolutely.
So when you have, the need where you need to be evaluated is to differentiate whether you just have fibroids alone or there are fibroids and maybe these other conditions like endometriosis, because you even find like the two conditions I've mentioned, actually, they share risk factors. So you'll find somebody has fibroids and on the other side they have endometriosis. And the treatment approaches to the two are different.
Wow. So again, the symptoms are not outstanding.
Yes.
The causes is not well known.
Yes.
So how do you diagnose this?
Okay. So, of course, the first thing will be based on the symptoms the patient presents. So when you come in and you have pain, heavy bleeding, and all that, we suspect you could be having fibroids or these other things. So most of the time you are young, you are having painful periods, recent change. Then the next natural thing is for you to have an examination by the doctor. Usually we look at the tummy. At times we might find the uterus enlarged. A normal lady with no fibroids, most of the time you're not able to feel the uterus through the tummy when the doctor examines you. But with a uterus that has fibroids, you actually find the uterus is enlarged way up. Occasionally you even get it above the belly button. So you don't even need to struggle. You just feel the tummy and you feel it. So in that case, you can actually almost be guaranteed. The only two things that will commonly cause that in a young lady will either be fibroids or a baby. So if they're not pregnant, then it will most likely be the fibroids. Then now you need to go to the next stage of now doing investigations to actually confirm this. So the commonest investigation we use is an ultrasound. It's very cheap, readily available, and almost every outlet in the country, even the smallest towns, have an ultrasound. So we do it an additional tool to help us confirm what we have suspected. So it will now tell us that actually what you are feeling is just a fibroid, not a baby, though they can occur together. Occasionally you can find there's a baby and a fibroid.
So what happens when it's occurring at the same time? When we talk about how we manage, for example, fibroids,
we only manage them if they're causing problems.
Okay.
So it doesn't mean seeing a fibroid equates removing it.
Yes.
Yeah, so most of the time if you have a fibroid and you don't have any fertility issues, your periods are okay, we don't even bother to do anything. But if you have fibroids and you come in pregnant already, the only thing is that your pregnancy journey might be a bit rough because of the pains, but you can actually carry the pregnancy all through to the end. And many actually carry the pregnancies to the end. And if the fibroids are not anywhere on the baby's, on the outlet of the birth canal, then the baby can come out naturally without even needing a cesarean section.
Cecilia, how was your experience?
I think it's not interesting, especially when it comes to your periods. Yeah. And of course, the tummy. I'm always being asked if I'm pregnant, but I'm not. So it's not an interesting thing. So it's important we remove them. But for me, I think I'm scared of the surgery. And as we were talking with Dr. Harry, there are other things that have come up. I think you're going to share, which is very interesting.
Okay. So did you undergo any kind of treatment personally?
I've not yet for now, but before that, I went through laparoscopy.
Okay.
Yeah, I've gone through laparoscopy, and of course, my 3 kids have done, my 3 children have done surgery, so I'm kind of scared of theater and all
going
these
back
things.
Again
yes,
to that.
Going back to that. And that is what people say, like in the organization, everybody's like, I don't want to go to the theater, I don't want to go to the theater. And I think now with the new technology that Dr. is going to share, I think it's important that we all go and do it.
Okay.
Yes.
Dr. Do we have any other options now apart from surgery? Because as Cecilia has said, you get scared when you hear, you have to go under the knife.
Okay. As I said earlier, fibroids, you only touch them if they really need to be touched, when they need to be out, and mainly is to improve the quality of life of the patient. So if you are bleeding heavily, then you will not be able to do your normal activities, your blood level might be down, then you need to get boosters or occasionally even blood transfusion and such. So the commonest treatment modality that we have is actually surgery. That's the traditional one that everybody knows, which we have to do an open surgery, so cut down on the lower part of the tummy, or if they're very big, occasionally we might cut in the midline to remove the fibroids. Currently, when there are not very many, and depending on the size and their location, there are a few outside the uterus, we can do a laparoscopy, which means we just use 3 incisions on the abdomen, usually 1 at the belly button and 2 on the sides, then we are able to remove them. In the event that you just have fibroids in the cavity, which means inside your uterus you just have fibroids only there, I need to emphasize that the fibroids that cause heavy bleeding are those inside the cavity or within the wall and pushing into the cavity. So those ones, we can actually remove them through the birth canal. So we go in with a camera, distend or balloon the uterus a bit, then we are able to shave them off, and the symptoms most improve, and even chance of getting pregnant becomes higher. Now, those are the surgical options, the common ones. We can also do medical treatment. Medical treatment means you don't want surgery, but you want your quality of life to be improved. So here we're talking about using painkillers. For heavy flow, we can use
managing.
Just managing the symptoms, really. And there's a medicine we give to cause the fibroids to shrink, but that one usually, when the medicine wears off, usually after 6 months, 3 to 6 months, they grow back. So the new technology she was talking about is called uterine fibroid embolization. And in this case, we target the arteries that supply the fibroids with blood, because you realize that the fibroids grow within the uterus. So they get their blood supply from the uterus. So we go in through an artery in the leg, either the left or the right, and we go in with a small tubing, and we are able to image it in a screen and see it. Then we block the artery supplying the uterus on both sides. From the knee? We go from the knee. There is no cut on the tummy. And with that, actually, especially patients who have heavy bleeding, their periods usually reduce by up to 95%. So you find if you are somebody who uses 10 pads a day, for example, on your heaviest day, you can go down to using 1, or even occasionally just using a liner or something very light.
Wow.
So it's a common technology. We've been doing it at Aga Khan since 2009, and a lot of women have undergone it with very positive results. And yeah, those who fear the knife, and especially when you feel you are almost done with the childbearing, you can consider it.
Yeah, but even just hearing you explain to us how it actually, the procedure is taken, you know, it's a bit scary. Are there any risk factors?
It's actually, you need an expertise to do it. So the people who do it are actually highly trained. And the risks for the uterine fibroid embolization are not as high as an open surgery. Because for one, before we do it, we map out the fibroids. So we'll do an MRI. So we only said earlier you do an ultrasound. Now when you need these additional procedures, you do an MRI. Though you can still do an MRI even as your first investigation, but cost becomes a bigger issue for a majority of Kenyans. So with MRI, it's able to give us an actual number of the fibroids, their location, and their sizes. And then we are able to see the approach to use to block them. So once we know this is the dominant fibroid, then we'll be able to go in, and usually it's to block the uterine artery and occasionally any branches, any major branches going to the fibroids. So it's not scary. The whole procedure takes about 15 minutes. 15, if it goes very long, maybe 30 minutes.
15 minutes, you're done, and you can walk back.
You're in theater and out. We usually observe you in hospital for 1 day. After 1 day, you go home. Compare with an open surgery, which can take even 4 hours. Because if occasionally you can find you have many fibroids, very tiny ones, and then you may not end up removing all the fibroids with open surgery. Because as she has said, she had fibroids removed, they're now grown back. So with fibroids, with the embolization, because you block the blood supply, the chance of them, the symptoms coming back is much less.
Okay. So, and we always say prevention is better than cure. How can we prevent fibroids? Cecilia? Might you know, or do we throw that question
just
to
throw it back to Dr. Because I don't think there's, I don't know.
Okay, so I think like for us, the black race, we are already predisposed, so we can't really prevent that. So that's an inherent thing. In terms of anything that you can actually go out of your way to do to prevent yourself from having them, there is nothing specifically that has been shown. So the things that they say, like maybe childbearing, trying to have children, those have just been shown to reduce the occurrence. But we still get people who've had those children, even the first one by the age of early 20s, and they still have them. So you don't have a specific thing that will tell you now do A, B, C, D, so that you don't have fibroids.
Okay.
Yeah.
Wow, thank you very much for joining us in this conversation. Cecilia, what an honor to have you on the show. And Dr. Oindi, we are so happy that you've come through and you've just given us important points on what to do. And I hope that you back at home learned a thing or two on fibroids or all the segments that we've actually covered right here on K24 Alpha Jury. We have now come to the end of the show, but remember the conversation still goes on our social media platforms. Just remind you that our Facebook page is K24 TV, Instagram and Twitter is at K24 TV. You can keep on asking all the questions that you have, and we will be right here to answer them.
Absolutely. Thank you for driving that hugely informative conversation, because, like we said earlier, fibroids are more prevalent than one would imagine, and there are ways in which they can be managed that your life is just not a complete misery.
Very true. That indeed wraps up Wellness Wednesday. We are done for the day. We are back tomorrow, of course, as we get ready for the long weekend that is upon us, coming very, very soon to where you are. So make sure you've done all the work that you need to do, because from Kesho, we all know the weekend begins. It's all downhill from there. Have a great day. We'll be back tomorrow. Bye-bye.
Bye-bye.